Class is in session.
Hey, everybody, and welcome to Unlearn 16. Class is in session. Today, I want to talk about a little bit of an extension of a TikTok that I just did surrounding Ontario and probably Canada at the very least, if not the United States, healthcare industry. Um, First and foremost, I grew up in hospitals. Why? Because my mom was a nurse and I took my first steps to my mom's, head nurse, Mrs. Lechez, and I'm very comfortable in hospitals. I feel very safe there. I've always felt as though I know where to go to get help. I've always thought that it's a place where you go and people know what they're supposed to know, give what they need to give, and it's this beautiful sort of symbiotic place of intelligence, of empathy, of caring, and of obviously health. Now, over COVID, as many of you know, my mom got sick. So, my mom, we found out, or she found out, that she had bladder cancer. And when we found that out, I mean, it just threw us into a bit of a tailspin. So, we found out, I don't know, in October of 2020. So right before COVID, 2019, right before COVID happened in that March, and we found out, and she had to go through a line of chemo, and then she had to get her bladder removed and a hysterectomy, and all of that was freaking terrifying. Okay. And during COVID, I couldn't go in. So, and I understand before people are like, oh, it was so horrible. Listen, COVID was a horrible, horrible time in which people were terrified. Hospitals were doing their best to mitigate the health of their patients. And my mom had to go in there without me. So I couldn't go there and spend time with her when she had this surgery. She stayed there until she eventually came out, and then she had to go back in. But I couldn't be there. One time I was allowed to go in, I think, and I could take her a little bit of food. I was only allowed to stay limited time, and then I left. And my mom, this was the point that I started seeing serious cracks in our healthcare system. It's not to say that they didn't exist before, guys. My mom was a nurse for almost 50 years. She was the head of the union at St. Mike's Hospital. She saw the gradual deterioration of healthcare in Ontario. She wasn't there when Doug Ford got into power in Ontario. She wasn't there for this right wing kind of shift. But she lived through Mike Harris. And for anybody who knows Mike Harris, his nickname was Mike the Knife in Ontario. He cut social programs and amalgamated hospitals. And really, in my opinion, started this trend and this train of gutting the public healthcare system, crippling it so that they could sell the need and the essential reality of private healthcare coming in, swooping in, and saving us all. I think it was always very much a plan. I think healthcare is incredibly expensive. I think the way that we do it in North America and the West is ridiculous. We are all about reactive healthcare. We spend next to no money on preventative healthcare, preventative regulation, or any of those. It's all extra money that you have to pay in order to get your health on track. In order to, even in high schools, I see it all the time where you take grade 9 phys ed and that's it. You never have to take it again. You never have to be educated or aware or trained about what your health looks like, what food health looks like, what bodily health looks like. It all gets chucked out the window because it's not as important as learning Shakespeare. Not that Shakespeare is not important. I'm just saying we probably should have a balance. But it was during COVID that I started seeing cracks because it was my experience. That's it. That's it. People are like, it's fine. It was fine until, no. You just weren't in it. And if you were in it, that slow, gradual deterioration just felt like a heavier weight. You couldn't necessarily point to it and go, That was the moment. I don't think there was a moment. I think it's kind of like, the frog in cold water, and you just gradually turn up the temperature and he never knows enough to get the hell out of the pot before he's boiled. I feel like that's our healthcare and our education system, but today I'm just going to talk about healthcare. So, my mom came back after having, you got to remember, like, she's in her mid 70s. She had her bladder out, she had her a hysterectomy, and she was in there not even for a week, less than a week. And they were like, "You're fine, go home." And we went and got her and brought her home. And my uncle Ray and I were taking care of her. Anna was here too. But I remember Ray, my grandma was there. Ray and I, she couldn't get up. She was in so much pain. She was still bleeding. There was a moment Ray and I were trying to help her up. And I looked at Ray, and I've never been so scared in my entire life, because I thought, this, I can't do this, right? I took time, Ray took time, but I can't do this 24/7. And if they think she was healthy enough to leave the hospital, is this where, like, I had no idea where she was at. And within 2 days, we had to take her back down to the hospital. And we had this beautiful guy who was an EMT, accidentally kind of, I drove my mom. And again, I can't go in, right? I drove my mom, and I needed to get her from the car into emerge so she could get readmitted. And this EMT came out and he helped her. And I'll never forget this as long as I live, because you got to know, my mom at this point, who's been a nurse forever, it feels so horrible and so ignored by our healthcare system when she was in there, and she felt that they pushed her out way too early, and they didn't give her the care that she needed. And she was like, just demoralized. This place where she put her whole life, she now couldn't even get enough care for them to recognize whether or not she was healthy enough to go home, and they didn't listen to her, and all of these things. And so she was, outside of being sick and outside of going through all of this stuff, and knowing that, the cancer could have spread and we still need to deal with that, she just felt like there was nowhere she could get actual help. And as I was trying to get her out of the seat in the car, I couldn't do it. I wasn't strong. Like, I couldn't lift her. I couldn't, and I had to figure out it was just me. And this EMT came up to her, and I'll never forget. He knelt beside the car. He got real low, and he looked in her eyes, because he knew that she was in a lot of pain. And he also must have known she was scared, and must have known that that she just didn't trust it. And he looked in her eyes, and he said, "Angela, we are going to do this as fast or slowly as you want to do it. I am going to make sure you get to exactly where you want to go and where you need to go in this hospital. I am going to make sure you get the care. I am going to make sure that people take everything seriously in this hospital. I will stay with you." And my mom started to tear. Not because, just because there was this person who took a minute and recognized her physical ailments. The physicality of being sick is one thing. But equally important, if not, in my opinion, more important, was what her heart and her head were at in that very moment. And the soft skills he used, because I'm going to differentiate between two things, right? In the medical world, there's hard skills and soft skills. Hard skills where you're like doing the stuff, medication, IVs, turning patients, making them walk, right? Getting them on a plane. Hard skills. And soft skills are those where you talk to patients, you explain, you educate, you connect, you show empathy, you show care, you make them, or you help them trust you to go through this journey. And I don't think until that very moment she'd experienced any soft skills. And there's a reason for that. I am not in any, I need you guys to understand, I'm not blaming at all the nursing profession or in any way, shape, or form, because there's a reason that they're not engaging with these as much. So right then I felt a little bit safer, and she goes back into the hospital, and they realize she picked up, 'cause as you do in some surgical floors, she picked up a stomach bug that was pretty bad actually. C. diff can make you feel really sick for a very long time. And at that point, she went back onto the floor in the hospital in which she was staying, and she said, "I'm going to stay here. That's it. I'm staying here. I'm going to stay here until I feel good enough to go home." Well, not too long after that, they wanted to discharge her again. And I got angry because my mom said she wasn't. My mom's like, "I'm not ready. I can't stand up on my own. I can't do this. I can't do that. I don't understand." And what we realized very soon after that was, number one, hospitals have like a time associated. You have surgery A, you're out by the X amount of days. And they have to follow it because their job is to follow it. Otherwise, they don't get proper funding or blah, 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 right? Or they reduce funding that they need to use for many other situations. And my mom at that point said she wasn't leaving. And so I said, "Okay, they want to discharge you, but you're not capable. Okay, talk to the nurse in charge, the manager on the floor." She talked to the manager, and the manager said, "Well, you're going to have to leave here." And I said to the manager, because now I'm involved, I said, "You're going to have to drag her out. You're going to have to drag her out to another floor. She says she's not healthy. She says she's not capable. She is afraid. And you want her out of this hospital, yet she can't even she can't take care of herself in any way, shape, or form yet." And I said, "Go ahead." I go, but understand that I am going to publicize everything I can possibly publicize about this, because you're ignoring those basic needs, right? And as I'm fighting with this manager, I realize, one of the lovely little caveats into how healthcare has been changed is that a manager on a floor is a business manager, not necessarily a nursing manager. And those are two very, very, very different people, right? Her job was to make sure you have X amount of money. It's going to go here. If you can't handle it, and then this is what she said to me. "Well, then she's going to have to go to a rehab facility." I said, "Okay, how do we do that?" My mom said, "Well, I'm going to go there." And she tried to contact the rehab facility. The rehab facility, get this, the rehab facility came in and assessed my mom. And the rehab facility said, "She's not ready yet." I'm sorry. So our healthcare system is pushing patients out to go back home without care, without medical staff, without help. Push them back home so their families can try to take care of them. By the way, I don't have the skill set to do that. I also have a full-time job. And you're ready on day 3 to do that, but you're not ready to go to rehab because rehab says you're still too sick to do rehab? What? So at that moment, my mom and I said, "Fine, you're going to rehab." She was never going to rehab. My mom was never going to go to rehab. I said, "Mom, when you're ready for rehab, you can come home because we'll handle it. You tell them you're going to rehab." This is kind of bullcrap lies that you have to. So she said to them, "Okay, I'll wait for a bed in rehab. I'll wait till I'm healthy enough." So she was there almost twice as long because she wasn't ready for rehab until a certain point. And as soon as rehab said she's okay for rehab, we can take her to a rehab facility, I called the manager and I said, "Don't worry, I'm going to bring her home." I hope she got the tone of my voice. And then my mom came home. And there was some amazing people along the way. But my mom never once felt safe, never once felt educated, never once felt that somebody was trying to make her understand and have serious conversations where she could trust them. All of that was broken, shattered into thousands of pieces. And those soft skills just didn't exist. And the reason those soft skills don't exist is because we have allowed the government, different governments at different times, to slowly gut the system to the point where nurses are expected to have more patients perform hard skills to the detriment, to the negation of all of the sit down, discuss, have a conversation, make sure they trust you, make sure they understand it, make sure they understand the doctor's orders, make sure they understand their illness. It's all freaking gone. And the problem during COVID, the big problem during COVID was that somebody who is ill, I don't know if you guys are listening, how many times you had to go to the doctor where you're really scared and you're really sick. Your brain doesn't sit down and understand and process everything that's being spewed, even if you understand the medical language that they're speaking to you in. My mom was a nurse for almost 50 years. She understood the medical language, but she still didn't have the capacity to put it all together, to understand, to have a list of questions, to really, because it's all on her at that point, because there was no other person allowed in the room because of COVID regulation. And we realized that having a family member in the room isn't just this nice thing, isn't just this, oh, well, we should allow that to, no, 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 no. If you have family that's there to support you, and I know not everybody does, it should be the medical community should want nothing more than to have that family member in the room. Because that family member gets to be a second set of ears. That family member gets to write down questions. That family member gets to process it and take it in differently. That family member gets to sit with that other person who is going through the trauma and through the risk and through the thick of it. And that family member, even though they're going through it with them, gets to be that sober second thought in that anarchy. And having that time, and I've gone to a lot of meetings since with my mom, a lot of, medical appointments. And without me in that space, I don't know if she could even understand what is going, at times. Now she's doing great, but like in the thick of it, I don't know if she could even have understood what was happening. And by the way, there were times too when you're going through chemo, when you're going through immunotherapy, when you're going through all these medications, let's all be very, very aware. It messes with your brain. I mean, one of the scariest minutes, my mom, and I took her to Emerge, but she didn't know my birthday. And I'm like, what do you mean you don't know my birthday? And I go, we're going to Emerge. And she didn't want to go because she was getting very sort of angry that she was fine. She didn't want to go to the hospital again. And I said, you don't know my birthday. And we joke about that now. Really, every once in a while, I just quiz her. But these soft skills had been obliterated, and they've been obliterated by the fact that they don't take them seriously at a governmental level. I know nurses do. But even that, you're starting to see training go away from those soft skills because they have such a high demand and such a quick pace and such a significant patient load. Right? You could work 24/7 as a nurse and as a doctor in this particular health age, and you still won't get through all the patients in a good enough time. And that's all money, right? We want to get them in, get them out, get it done because we have such a lengthy list. But when we treat them like mass production, they don't get healthy in the same way because our health, our physical health, is directly tied to our mental and emotional health at that time. And nurses, the way my mom was taught, the way my mom was trained, nurses are the backbone of empathy, of care, of education, of having those conversations so patients feel safe, protected. So many nurses have left because they're like, I can't do for my patients what I need to do. There's too few of the nurses, Too many beds. If I hear my government say one more time, we've increased the number of beds in all of these hospitals so everybody has a bed. Where are the nurses, Doug? Where's the support staff? Where are the doctors? Where are the MRI machines? Where are the CAT scan machines? Where are the x-rays? Where are the immunotherapists? Where are the cancer doctors? You keep adding beds for what? So it becomes like a MASH unit. There's no more time for soft skills. And the government consistently hides and negates that. And to be honest, I know for a fact they're very quick to push it off to, well, nurses nowadays are just lazy. They're not doing their jobs. I'll tell you what else they're doing with nurses. By the way, they're trying to find every single way to get nurses different credentials in order to pay them less for doing the same job. That's why you have an RN, you have a nurse practitioner, you have an RPN, you have an RNA, you have all these different levels. By the way, they're all very much expected to do very, 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 very similar jobs. And the government's just trying to figure out ways not to pay an RN because the RN is at that top of the pay grade, right? So if you go to university, you become an RN, you're at the top of the pay grade. Everything else we're trying to figure out, oh, you can just go to college for this and you can do part of their job. But in essence, you can do all of an RN's job. We're just going to pay you 60% of what they're getting paid. Every step of the way, they're looking to defund, they're looking to reduce the amount of education that nurses require. Not because they think they should be less educated, but it's the only way they can pay them less and justify it. We talk about doctors, we talk about support staff, all of these people that have been gutted, that doesn't give time for nurses to sit down with their patients and talk about what they're going through. Those are just as important as soft skills, as hard skills are when you get your chemo. Because if you don't understand what's going to happen to you, if you don't understand the impact. Now, Princess Margaret, I have to say, has been just absolutely beautiful with that. This wasn't during COVID. Their goal is that, but they are overwhelmed, guys. Overwhelmed. I was just at another hospital visiting a friend, and I was in that room for, I don't know, maybe 2 hours, and not one soul checked in. And they're going through it. Okay, it's not one soul checked in. Not one soul put their head in and say, "Hey, you doing good? Everything's cool in here? You all right? Amazing." Those personal connections can't be made. And they're so quick to want to turn around and shift them to another floor and shift them to this floor and not form any personal connection. And I haven't even got to the absolutely devastation of hiring on-call nurses to fill from private agencies rather than the hospital, so that it can fill the need, and they're constantly going to different floors. So there's never relationships being formed between nurse and patient. They're always new. They don't know each other. They don't trust each other. They don't have time. And all of this is fractioning. Not just your experience, not just how you feel, but how you get better. And everybody's saying, well, healthcare is so expensive, so expensive. You know what's more expensive? The fact that somebody goes in for surgery and has to go back 2 and 3 times because you didn't do the job right in the first place because you don't have the funding to do it. You didn't teach a patient what they need to do in order to stay healthy, in order to be on track with their medications, be on track with their therapy, be on track. Like my mom at any given moment can be talking to at least 5 different doctors. And again, she was a nurse for 50 years. That's a lot of balls in the air for somebody who is 75. And instead of going the other way, instead of being more holistic, instead of understanding the patient, instead of making sure they have consistent care by the same medical provider, We're just trying to save money. Have to save money. And does it fall on the hospital? Well, I guess. Sure, because they're the ones making decisions. But if you're talking about governments who are choosing where to cut money or how to spend money, again, I need 1,000 more beds, but I don't hire any more nurses. When you have a broken connection between the people that work in a hospital and the government trying to dictate the policies, the economic structure, the budget of a hospital, are you kidding? Politicians shouldn't be allowed to dictate budgets of hospitals without hospital boards telling them how they have to spend the damn money, how much money they need. Now, where does that all fall? I'll tell you where it falls. It falls on us. Falls on us, guys. It falls on us when we all decided to be so happy with guys like Doug Ford giving us back our license plate sticker money. The $1.3 billion that the government of Ontario is no longer taking in from us because we no longer have to pay for a yearly license plate sticker. Where do you think that money was going? Where do you think they're taking it from? You say, oh, thank God I don't need to spend $120. Oh, you're going to find out where that $120 came from when you need to get your gallbladder removed. You're going to find out where it came from when there's not enough people giving chemotherapy in Princess Margaret Hospital because they've lost funding. You're going to find out where it came from when your kid gets hurt and you're sitting in a lineup at a merge for hours upon hours upon hours, complaining about what? The hospital? Don't you dare. You got $130 back. You were happy about it. You either voted for it or, as a lot of people, chose not to vote at all because we didn't like the options. We were apathetic to the choices. Well, here we are. You can sit around and say, I'm not paying more taxes. You can sit around and say government, but there's a lot of things you can demand the government of your province to do. And in my opinion, they have two jobs, two big jobs, healthcare and education. And every time you hear their driving force is to balance the budget, let's just remember that balancing the budget isn't at the expense of adequate, sustainable healthcare. And by the way, balancing the budget today and taking money for that healthcare 5 years down the road, 10 years down the road, how much more do you think healthcare is going to cost when you don't have enough money and you don't budget enough to do the surgery right, to have the right care in the first place, because they're going to end up back in the hospital for secondary care for the same issue, which is more expensive, more damaging, and more life-altering. We do all of this home care, guys. Ugh. All to get people out of hospitals. They fight about who's going to pay for it, how they're going to pay for it, how they can privatize it. And every step along the way, you want to know who loses? The patient. You have nurses and RPNs and RNAs getting just rocked left, right, and center. And we're all turning on each other. It's a real beautiful thing the government's done. How does the government get more power? Well, they say to people, I'm going to give you everything you've ever wanted for less tax dollars because the government before just spent it badly. That is always, always an absolute lie. Always. And I'm getting real tired of it. I'm getting real tired of it being spewed. I'm getting real tired of people falling for it. Soft skills are the only way we're going to actually build a healthy system. And here's the bottom line, guys. If we want a healthier society, if we want a healthcare system that isn't so demonstrably weighted and heavy and expensive, we have to We have to spend more money now in healthcare prevention, more money in schools, more education programs, more nutrition programs, more physical health, more mental health. All of these things need to be inundated in schools, inundated in corporate life. The expectation can be of preventative healthcare measures can be distributed across the board, but it's going to cost us double until we get this generation all caught up. Right? You got to pay for the people that didn't get the education in the first place and didn't get the healthcare advice and all of those things because now they're sick and they're overwhelmed, and you got to pay for the prevention. If you're going to start paying for the prevention, guess what we got to start doing? Talking about crap like food. What government services are allowing what food? What are they causing? We got to start talking about physical health. Grade 9 isn't the only year you should be taking gym, for the love of God. And it's all of it. We think it's because it's too expensive and private healthcare is going to swoop in and fix it all. I promise you guys, it's not. Go spend any time you want to spend in the United States of America. Watch people go into medical bankruptcies when their kid needs to have heart surgery. Don't you dare, don't you dare believe. And by the way, you're just choosing to believe in a fiction. Don't you dare believe that a government's going to be able to do more with your money and need less tax dollars because this system's going to get better all on its own. It's not going to happen. I want some honesty in my system. I want somebody to stand up there and say the healthcare system's going to cost us more money. Do you want to pay for it? If the answer is no, go ahead, say it. Say it out loud and say it with your vote. And I would have it as a one policy. That was it. That is the election issue. What do you think our healthcare system should look like? Because I'm telling you right now, guys, the more that I see soft skills being deteriorated, the more that I see nurses leaving on droves, the more that I see doctors leaving on droves and people not getting the care they actually need, the more expensive our healthcare system is going to get and the less healthy we are all going to become. My answer is frustration, sure. But I need everybody to understand when you are frustrated at a hospital, when you don't have those connections, when you are the frog in the lukewarm water, recognize who's making those choices, how they're making them, and how your vote led us right down that path because you don't want to pay for a license plate sticker this year. And on that note, guys, thanks for hanging out with me, and I will see you next Tuesday. Same bat time, same bat channel. Dismissed.